Hello and welcome to another episode of Hornbill TV's Health Talks. Good day, Mukan. Healthcare professionals, doctors, aro experts kan ge anigina. Alag-alag topic, alag-alag diseases, alag-alag bimari kan la oborde janकारी. Aro anything related to health, edu kan la oborde janकारी aro awareness kan digina jalaga program ase. Aro ajido we are joined by Dr. Obang Jungla, taido Palliative la physician ase. To আজি মহান টপিক কথা কুরলেলা অপরডো প্যালিয়েটিভ খেলা অপরডে হওয়া সো মহান টপিকতে না জাগিতে মই ডক্টর অবাং জুংলা লাগা শর্ট ইন্ট্রোডাকশন দি দিব তো তাইডো হলে শি ইজ আ রিটায়ার্ড মেডিকেল অফিসার আছে আর তাইডো শি ইজ presently currently এটা executive member আছে এটো Indian Association of Palliative Care লাগা আর she is the only representative of Northeast from the Northeast for Indian Association of Palliative Care laga aro tai eta home-based palliative care physician for home-based palliative care edu serene palliative care koina tai edu laga bi tai julai gina jaise so today we are very privileged to have with us Dr. Obang Jungla. So Doctor, thank you so much for being here and joining us today, and yes, welcome to Hornbill TV.
Thank you so much for the privilege.
We are so happy to have you here today. So Doctor, to begin with our topic palliative care la opode edu to start off edu palliative care kwado ki ase
Palliative care kwado itu manu ekjon beshi bimar hoa thakya time di tar laga quality of life improve kori dibole laga ase aru tar patient bimari noigana family members kan nimiti bi itu include korigana ase aru itu palliative care bra itu bimari do prevent aru relief bi dia laga aru itu kiniga korigana itu relief aru prevention koribo koile early identification bimar julti identify koribo lagi aru phal kora bimar do ki ase assess koribo lagi aru treatment do thik dibo lagi aru especially for pain relief aru dusra hi noigana khali physically noigana itu emotional social aru itu spiritual lagabi care kori ase under palliative care aru itu palliative care to process ekta tar kinika korigana itu care kori ase kwa to continuum of care to tar first diagnose kora tambra itu end of life aru manu murigana bi aru bereavement period tak bi palliative care pra care kori ase ki hoile bereavement bi include kori ase kwa to patient laga family members caregivers kan do tar khan patient sa tam de tar khan bishi tuk korigana haigana thakya time de aru bi tar khan bishi murom lagya ekta family pra jaigana thakya time de itu khan laga bi care no korili itu mental emotional laga do bishi problem aru bi tangor hoya se itu pra palliative care do diagnose kora lokopra aro disease process kiman jaya se aro itu bichi de ta khan end of life aro death aro bereavement dak bi saya se
okay so doctor edu curative treatment really edu hospice care na edu palliative care aro hospice care hospital treatment jahan la edu kinika alag ase edu
itu palliative care do quality improve korobole laga ase aro itu pra physically noy emotional spiritual social itu kan to side dia ase aro itu curative hoa to itu bi therapeutic ki ase itu laga aim to chichi hoile pi itu patient do cure kore diboli nimiti tar bimari ekta thakile itu to ki hoile bi para tak cure korbo nimiti ase aro ito hospice kwa to it's like palliative care service dia nichina ase hoile bi inika patients kan do itia to cure koribole laga nohoy aro tawai bi treatment bi iko tiboli bi nai aro the patient tar end of life ekta di ha time di few months tagya time di itu hospice care do dia ase
okay so doctor edu palliative care kwa do ki age kan bra receive korle pare nolibi patient kan tahan ki stage punjadam de palliative care do recommend kore
palliative care do itu sub age group ni media ase pacha ekta hoili bi tar disease chronic disease aro life threatening disease kan bi thakibo aro adult khan hoile bi aro elderly khan hoile bi alak alak bimar dangor pura thurigana thakya time di itu khan sob ki bi diboli paribo aro itu khan ase
acha so edu palliative care gando tahan edu patients khan bra chemotherapy nohile bi radiation surgery na edu tahan lo adam dibi palliative care bi lo le pare na kinika
hoy itu lobole paribo Nichina diagnose kura tambrai palliative care dia hi quality of life to thakibo long run de itu pra chemo dialibi surgery holibi radiotherapy dia dam debi itu palliative care to itu darkar hoi jay ase
acha to ida do mohan palliative care do kinya kam gure edu han law pore saina chabo so palliative care do hoise gole do is it just for reducing pain nolibi is it just for reducing pain or edu bra tahanla emotional edu mental social problems edu handibi sai na chai
mostly it's also for the pain relief ki hoile ekjum bimar hua time di main problem to pain ase aro itu upor di aro bi ekjum bimar hoigana thakya time di it's not only the physical pain hoile bi tar laga bhavna aro tar laga social economic itu khan sob aro spiritual itu khan sob to bimar hoi jay ase tar bimar hua tam di ekjum manu to ki hobona moi bimar to thik no hobona noheli bi tar bhavna bishi hai jay aro moi khan saili ini Nagaland di do it's a low socio-economic maturity to ase itu time di bimar thakya time di treatment dangor jabole ase poisa na thaki noheli bi family problems socio-economic problems to bishi thaki jay ase aro ek kisam to saile aro bi spiritual kitiaba to moi kinika korigana itu moi to ikup kam bia hua nai holibi kinika korigana chisor pra moi ki iman dangor bimar dia asina ki nohilibi moi ki kam bia hoigana inika laga spiritual struggle bi bishi thake ase to bra palliative care do ini physically noigana itu kan sob to sai dia ase
okay to okay doctor apni area mention gura nishna palliative care do le tahan la patients kan laga emotional social edu kan sob sai gina jai to as a palliative physician apni han edu process to kinika modot kore tahan ge na edu treatment plan kan do kinika chai tahan ge modot kuru bole
mo kan itu multidisciplinary team ase nurse doctor aro itu psychiatrist psychologist counselor chaplains kan itu kan ase itu mo kan nurse doctors kan to usually we focus on the physical aspect tar bimar ki physical bimar ki ase itu kan bishi bak to sai holibi itu emotional kan stress depression kan itu kan thakeli to itu aro spiritual itu kan problem thakeli mo kan itu psychologist psychiatrist aro itu chaplain kan counselor kan ki itu bi manage korbole dia ase
okay so doctor edu palliative care treatment diole lado team khan do kun khan nishna bra ahigina edu palliative care do dibole pariwa alag not just physicians doctors kan eklan hoina na to help with the patients kun khan lagibo
itu patient laga bimari upor dia ase khali itya to physical laga problem me ase koili to nurse doctor kan bra take koribo holibi ta khan emotional problem nohile spiritual problem thakile arupi accordingly chaplain kan bi haibo spiritual needs emotional kan laga tu psychologist haibo inika team tu tar khan darkar hua time di itu kan sup tu high dia ase help to
okay so alag kan do kun khan bra diole pariwo like volunteers NGOs kan na duan bi kinika tahan bi care do diole pariwo
itu volunteers khan laga bishi important ekta ase kunuba patients kan to bishi bedridden aro itu bishna bra bi dar nature uthiboli napare khan to if there are volunteers in the community itu volunteers kampra ta khan laga gari thakili patient tu check up ekta review thakiboina koile volunteers khan tu ta khan laga gari ti loi jai hospital te loi jabo noele bi doctor khan ki visitation thakya tamte ta khan ki loi jaiga na ta khan doctor ki sabole dibo aro itu pichiti aro bi wapas ta khan laga gari bra ani dia laga ase dusra state like Kerala nishina ti do IS officer khan retired IS officer khan itu khan volunteers pichi ase aro ini Saudi Arabia nishina de chartered accountant khan kam tangoria kurigana ha khan tu retire kurigana thakya khan bi ini volunteer service dia ase to itu volunteer laga kam bi bishi ase sob bimari khan tu garibi nethaki aro ta khan transportation tu gari brai lui jabo lagi inika kura tamdi volunteers laga help to bishi hai jai
okay aro family members khan brabi kiniga dibole moto dibole parwa
family members khan bi itu palliative care team di bishi important ekta ase ta khan laga tu backbone nishina ase ki hoile patient ekta bishi bimar hwa tu hospital laga treatment do all of short period of time me ase konoba ek hafta noheli konoba to few months inika thakika na rest of their life will be at home only itu time ti family members aro family caregivers kan do bishi important hoi jai
so doctor apni age de kwanishna edu palliative care do it involves not just doctors or the family members it involves alag volunteers kanu bi NGOs na tahan bi to apni han kiniga tahan lode link kure aro patient ekta ke care diole karne apni han do kiniga all of you na all the teams kiniga link kure na ani gina edu patient ge modot kure
itu ekta mukhan supposing doctor ekta pra nurse na thakili itu kam tu chapuli na pare nishina itu mukhan aropi psychologist hoilibi aro psychiatrist kan hoilibi volunteers hoilibi itu kan identify koribo lage aro kinika kurigana identify koribo koili awareness aro campaign do bishi important ase supposing volunteers lage ase koili in a community we need to organize some awareness sensitization program ekta digana the duty of volunteers to ki ase tahangi sob phal kora samjai dili ultimately you will be there to help whenever tahan darkar hwa tamdi ini hai jabo
so doctor etia mohan palliative care laga results nolebi feedbacks ahya gan saishule do apni han etia tak patients kan ge care gorina ahya humoide tahan laga results nole conditional feedbacks kan na eduhan tia laga nolebi proof eniga success stories na patients kan palliative care lo abiste phal hoise tahan la life better hoi jase eniga laga success stories kan apni share kori dibole monas na nai
itu tar khan palliative care pra tar khan ki side digana satisfaction do pishi ase tar khan itu ekta bimar hoi jale patient ni noega na family members sob to tar khan ki kobo fear aro itu worry kura laga bishi hoi jai anxiety iniga laga bishi hoi jai holibi kitia palliative care pra ta khan ki take care koribo itu khan ta khan phapna alag alag phui lagia laga itu khan sob to ta khan relief hoi jai aro itu pichidi aro bi ta khan physical laga problem pain khan thakya itu khan laga bi reduce hoi jai aro comfort pishi pai thagi itu care digana aro tar khan itu patient aro family members itu laga understanding to pishi phal hoi jai communication bi phal hoi jai mane mukhan ekta patient bimar hwa tamdi mukhan patient do kitia ba to bishi agitated angry hoi jai hulbi tar ini itu kuriboli mon thakya pra nohoi hulbi tar emotional stress bi thakya time di itu hoi jai itu pura mukhan palliative care khan pra patient family khan ki samjai dibuli kinika koribo itu time dikini ka care korobo itu bi samjai dia ase aro communication bishi important ase itu doctor nurse aro family members patient kan logoti communication to bishi bhal hobo lage itu pura itu kan sob bi bhal hoi jai tar kan understanding na thake kana thake understanding hoi jai aro tar kan itu ki kan sob spiritual hoile bi emotional kan hoile bi sob sandi hoi jai aro tar kan patient kan ke care globally bishi duk koriga na thakya tu tar kan ki aro bi kinika care koribo itu shikai kana rakhya bra ta kan patient kan ki bi bhal kora care koribole pare iniga na medication kinika tibo nohile bi patient chutumotu tu khwatam di inika asiti goina samjai dia bra ta khan do patient care koribole bi bishi efficient korega na bhal kora jai ase inika feedback to ase
okay etia Nagaland laga palliative care in Nagaland laga state saishi gole do etia mohalla Nagaland do kute ase stage kundu de ase for giving palliative care na aro mohan laga Nagaland de saishi gole do kun kiki hospitals kan ready palliative care dina jaise aro are there enough since you are a representative of Northeast na palliative care la so rough idea apni thayo na like are there enough trained doctors and nurses na to provide korea laga
ठीक আছে itu compared to other states na moi kan Nagaland to kopu koili ityahi suru kura nishina ase aro first palliative care start kura do itu CIHSR de 2013 bra start hoise aro itu pichi di aro bi Eden Medical Center St. Joseph Pain in Palliative Care aro itu Zion Hospital aro itu NHK dia ase aro itu Impur Christian Medical Christian Hospital Impur Christian Hospital de itu 7 bedded dedicated palliative care laga ase aro itu body aro bi itia ekta home base palliative care sob milega na to satta ase hole bi sob to functioning to fully functioning do itu charta nishina brahi comprehensive care do dia ase itia tak to
Eden Hospital CIHSR do NHK koi mana chumude thagela charta na
itu osado na referral hospital CIHSR Eden Hospital aro St. Joseph Pain and Palliative Care aro home based care de comprehensive to dia ase itu NHK de dia to pain relief for the cancer patients itia tak to focus koriga na ase ta kan pishna bi nai itia tak yeah
okay so doctor since Kiribi Mekwanishna Abni do you are the sole representative of Northeast now when it comes to palliative care to apni kan laga side te hulibi aro government NGOs kan bra hulibi apni kan laga side te milagina ene mohala na bi palliative care laga more training more work to do koina phabia laga enya apni kan trainings kan hulibi enya arubi seminars hulibi na eniga care diole karne inline any upcoming events enya kane ku thagias na nai
itu laga subject to noton habra all the doctors and nurses itu kan do training dibole lage at least certified training course for 4 to 5 days laga thagibo lage aro itia to compared to the population doctors kan kom dia ase around 6-7 only and a few trained nurses only so iman Nagaland population census 2011 is up to 22 lakhs nishina ase it will be very difficult to cover by only handful of the trained doctors and nurses itu para itu bi bishi darkar hoi jai ase aro awareness aro sensitization bi bishi important ase aro government side para bi initiative to bishi tangor lobole lage because itu training natili to itu palliative care to service to tibuli na pare hoi jai itu para training kan awareness kan do bishi tibuli lage
okay so itia tak to any upcoming events inya kan la do eku line up nai na
Itia to iko nai hoilipi so far moi para facilitate kora laga ekta to through some organization from outside the state takan online training course for 1 year dibuli mona se ko para facilitate kori gana ase so itu kan be on the line
okay
itu kurubuli lagabi itu government doctors nurses kan itu free of cost dibuli laga training ekta to ase but so far it hasn't yet started I think
it's in line okay
yeah
so that's a good news actually
yeah
acha to itia payment system kan la aishugule do palliative care if chronic patients kan palliative care laga loy ase gule do tahan payment system kan do kinika loigina chai nului tu moi ekta hudu munja do doctor do insurance policy na aro say like ayushman eduhan labi palliative care treatment loa patients kan gedo cover kurina na kure
itu palliative care patients kan ki olopi cover korea si mane pain relief kan nohile bi small procedures kan nimiti ayushman para cover korea se hoile bi tangoria bimar itu ki kobo itu chronic patients kan ni bishi hoi jai like cancer patient nohile bi aro itu chronic kidney disease liver disease itu kan nimiti to bishi procedure tangor kuno pa hoboina koile itu kan para itia tak to cover nokuri
acha to itia sai shigule do itia tak palliative care de challenges kan do ki nishna han face kurina ahi ase apni
itia to iku challenges enega to nai hoilipi moi kan itu government side kan barabi itu pishi itu palliative care laga do training awareness sensitization to itu pishi kurili bhal hobo
edu olop komdi thagya nishna na challenges kan thagya da
challenges to pishi to itu to iku nai patients are willing to receive the palliative care services yeah
acha to etia mohan ekta side saishugule do palliative care laga patients kan do chronic patients kan hi mostly edu ani thage so in case edu patient pishi serious ho jashe aro that patient is approaching towards his end of life his or her end of life no to in your time de saishugule do mohan naga manuhan do we are very much rooted to our customs traditions and beliefs no to in your patient do bishi supposing bishi serious ho jashe and then tai sas lo le duk pai ase like nearing death na in a situation ai jashe so apni han palliative care la under de thakya dam de edu parents no libi tahan laga family members kan ba phat tahan gi hospital de loigina chawle lage inya phapna khan thagina na thage aro edu tahan muriule nishna hi duk payas na so apni an physical touch thagigina any peacefully chawle diwole laga aim asna eta palliative care do so inya time de apni khan family members khan gi bi kiniga pujai de no libi inya conflict kan dagi shegule do kiniga edu solve kurina chai
itu palliative care laga main focus to manu ekjun do it should not hasten the death manu ekta joldi murai dibuli laga bi noy aro should not delay death tar bimar muri buli laga to tar nature automatically it will come hoilibi palliative care laga care can receive kura kan do dia we make them prepared for any anticipatory problem juti any care dia tam di achanak inika hoboti kwa to tar kan janika na unnecessary hospitalization nohelibi unnecessary ICU ti ni chai chronic patient hoise supposing cancer patient ekta tar treatment do loise chemo loise radiotherapy bi loise aro surgery khan itu khan sob loise aro ajikali to immunotherapy bi ase itu khan sob complete hoise aro itu pichiti to tar laga chance of cure do itu na thakika na tar laga disease process to olop bia jai ase aro tar end of life bi high jai ase itu time di mo khan patient kan ki aro family members kan bi kibi disease process to phal kora samjai dia ase so they are willing to accept the course of the disease itu inika hoili ti ta kan kityaba achanak manu muribuli time to moi kangkumbi na jani hoili bi research aro ki chapra we have got some certain criteria manu ekta end of life ha tam di tu inika sign do asiti inika problems kan to asiti for example death rattle koi ase idu golati sas kurubuli na pare kana itu mucus kan pishi take kana awas pi olabo sas pi diktare hobo itu time ti aro tar laka health condition to pishi biya hoi kana thaki aro family members kan bi patient to pishi diri thake boli nohoi tar condition to biya ase inika to chani ase hoili bi kitya inika problem do hai jabo ta khan pishi panic hoi jai itu pichi de do ta khan taratari hospital de loi jai sometimes on the way halfway de manu to mori jai aro hospital pungchili bi tar pulse blood pressure kan aro sas bi tik nohoi kana pungcha time di do ultimately the patient will be put in the ICU which is not so required at the end of life when you know that the patient is going to die aro ini artificial resuscitate kore kana ventilator use korabi itu iku kam no hoi jai inika end of life ekta de ICU di jabole laga itu bra itu palliative care bra itu kan sob samjai dia bra itu takambi itu problem to family members kan bi itu kan problem to nethakia hoi jai aro we focus on high human touch and low tech ini itu manukan ekta end of life titu he should die in dignity we focus patients to die in dignity with family members around aro tar peaceful death thake boli mokhang koshish kori ase with all the IV tubings and then the ventilators inika hoi kana kun bi tar ki touch kurboli bi na pare kana inika laga titu murai tibole monai we focus on mura time ti dignity bra manu ekta murai tibole laga de focus kori ase
okay so doctor edu apni since idia do apni home based palliative care treatment di hole laga api apni idia chuli ase so why home based palliative care is important
itia palliative care do first services to kut dia se to moi ekpa samjai dibo hospital dibi dibole paribo nursing home clinic as well as home based care dibo dibole paribo aro why I've started this home based care is palliative care is looking at our Nagaland scenario chronic diseases aro itu lifestyle disease pichi hoi jai like cancer diabetes hypertension stroke chronic kidney disease liver disease aro itu chronic pain nohilipi ini dusra problems inika chronic to pichi thake ase itu upor di aro bi mokhan itu aging population bi hoi ase bura buri to pishi mura nishina holibi still bura buri age long life can be bishi thake ase itu khan nimiti bishi important hoi jai ase itu pura I've started this home based palliative care on charitable basis itu igana kun khan community ti kun khan bedridden aro chronically ill itu khan sob ki moi lokoti nurse for the time being nurse aro ekta ini evangelist ekta moi khan itu patient kange sapoli chai ase
okay so doctor edu manukun ba apni kan la services enya lole munjai se bole do how can they reach out to you
itu itia to moi khan la community de he start korega na ase because we cannot cover all the so much place itu pra itu moi ward 12 ti thaki ase aro ward 12 ti 6 colonies ase tati pra I have a good communication with the church platform de takan ki inika kuriboli mon ase inika kwatam de church kan leaders kan pra takan sob kordi kun laga itu chronic patients kan ase aro bimar dangobra thuri kana bimar ase itu kan sob to list de gana moi khan itu jai thake patient to saboli jai thake aru ta khan kitia darkar hobo tar khan bra bi moi khan ki telephone koribo inika jai ase aru tar khan treatment to loi ase from different doctors holibi moi khan to supportive nichina symptom management nichina jai thake because sometimes for example manu ekta patient do itu ini urine catheter urine jaboli nimeti catheter rakhigana ase holibi itu change kuruboli mo khan laga colony pra CIHSRT jaboli de beshi tor ase aro patient to pet return ase itu ambulance noile humai ganai jai dibole ase inika laga time di we are there to care to change the catheter inika nichinana to make their life comfort not only for the patients but for the family also aro tadipura aro bi socio economic lagabi mokan itu financial problem bi mokan ki itu care korabra ta kham bi itu quality of life sandi to thaki dia ase
okay doctor palliative care gushigule do manuan first najania manuhan karni do tahan first bhavna ya do people who are about to die tahan hi palliative care lage nulibi kunba ando they have this perception that palliative care do hishibule do caregiver na thagya dem de kore manu tahan ge sawle enough manu na thagya han hi nuli pura puri han na du tahan hi palliative care do lage inya la bhavna bi ase so what do you have to say on that aro apni laga final message na for people for chronic patients nuli tahan la relative khan who are unsure about palliative care na dahan garni final apni laga final thoughts aro message apni share kore dibo parwa
itu palliative care do itu end of life lagai noi holibi kwa nichina from the time of diagnosis patient ekta bimar ekta thorishi supposing chronic kidney patient itu patient do chronic kidney patient hoili do kidney failure thaki jai itu time pra we have to start the palliative care it's not only for the end of life be side hoili be it's a process itu laga sob process de mokhan do ini palliative care to dibole paribo aro palliative care khan do pacha dangoria aro puri khan sob ki bi itu bi dibole lagya because itu pura manakhani bimar dango thura laga noy holibi chutu pajabi sometimes since from the birth the patient the child the baby may require palliative care itu pra sob chutu pra dangoria tak to itu palliative care do diboli lagai hoi jai ase aro itu mano eni moi koboli laga do bimar kinika dangor hoi jai ase itu time di puila any julti itu palliative care do like lubuli bhal ase itu hoile tar laga itu quality of life bi bhal hoi jabo aro patient hi noi kana aro bi itu family members kan bi itu santi thakibo aro itu pichiti physical laga bi aro care bi thaki aro tar laga bimari pain aro related symptoms kan bi dusra complaint kan itu kan bi sai dibo aro itu ek family dynamics to bishi important ase itu pura ekta bimar hoili ekta to affect kori jai aro ekju mano bishi diri bimar hoili caregivers kan to itu burnout hoiga na takan relationship bi thik nohoiga na the patient is not getting proper care itu pra itu palliative care pra itu kan sob to samjai diga na understand kori dili care do bishi bhal hoi jai itu pra itu kan sob to jani jai aro itu palliative care ini juldi loi ja to tar khan itu problem ki hoi jabo itu kan bi minimize hoi jai aro hospitalization chutumoto problem khodi olaili itu takan panic nokori kana hospital na pisari kana takan brabi manage kura lagabi aro itu hospital admission kan noilibe ICU lobole lagabi komti kuri dia ase aro itu inika care dia para itu advanced care planning goi itu patient du tar kinika tar laka disease process jaiga na tar kinika tar laka life to end kuribole mon ase itu bi bishi important ase ki mane ekjon bemar thakiga na patient bra to moi bishi serious hoi jali moi laga bemar to bishi tangor hoi jaise moribole ase to bra ICU ti narakhibi di kwa tam di tar to unconscious hoiga na patient bra na jane kana ini family members kan to ICU ti bi rakhya laga case bi bishi hoi jaya ase hoili bi patient laga here and palliative care itu ethical bi bishi high jai itu bra patients autonomy laga to respect korbo lage tar laga wish aru tar laga last wish to chichu hoili bi respect korbo lage itu bi mokhan itu samjai gana treatment do cha tamti ta khan bishi itu benefit hobo itu laga
Okay, so doctor, thank you so much. Apni yade ahina man busy thagina we edu janकारी palliative care lobore janकारी phawa diarne bishi thank you diase. And yes, apni laga home based palliative care labi apni loina chaise, so we wish you all the best for that as well na.
Thank you so much.
Okay, so edu thaga se aji laga health talks at Hornbill TV aji mohan palliative care labore janकारी aro awareness kan bi Dr. Obang Chungla bra bishi bhalwa explanation aro edu janकारी kan di dishe. So edu nishna alag mohan hotai muina enika health topics kan laga oporde anigina alag alag experts doctors aro anything related to health edu kan la oporde mohan janकारी kan di hina jabo. So for more enika laga updates kan site gole site gi Hornbill TV.